My name is Renee Bova-Collis. I am the Patient Services Director for the MidAtlantic Renal Coalition. And I want to thank you all very much for coming out here today, and also to the National Kidney Foundation of Maryland for having me, asking me to come and speak with you all. I'm going to be talking to you today about patient engagement. So let me see if I can advance this. Excellent. First, I have to tell you that anything that I share with you today really is on me. We don't want the Centers for Medicare and Medicaid Services to be misrepresented in any way, so any information you get out of here, it's from me. I'm trying to be as accurate as possible, but there is some personal bias that's going to get into this presentation. I will try to identify that for you. But I think that most of the information provided will be helpful to you. I'm going to talk for about 30 minutes, and then there'll be time for questions and answers. So if at any time you need clarification on something, you feel free to jump in. So what we're going to talk about today is who the MidAtlantic Renal Coalition is, find out a little bit from you about what engagement means to you, what engagement should be in a dialysis clinic, how my organization engages patients on their level. Yes. The other thing that we're going to talk about is things that you can do to be engaged. I'm going to help identify some things like that for you. So one of the things that happens at my organization periodically is someone calls asking for Mark. There's no one at my organization named Mark. Mark is an acronym of the title of our organization, the MidAtlantic Renal Coalition. How many of you have heard of the MidAtlantic Renal Coalition? Have you heard of it related to or called Mark?
Yes, I could ask you to be a patient ambassador.
Oh, very good, very good. Have any of you heard it referred to as the network or Network 5? Okay. Well, I'm impressed that the few people that did raise their hand did raise their hand. We have a bit of a PR problem at the MidAtlantic Renal Coalition. There aren't too many people that are aware of us and what we do, so we're working to try to get that out there. It's not just among the folks who receive dialysis or transplant, but it's also the providers who don't have an idea of who we are. So we're trying to work on that. Can I ask how many of you here today are dialysis patients or transplant patients? Quite a number of you. Are there any professionals in the audience? Family members or caregivers? Okay, great. All right. So for the folks who are in dialysis facilities, do you recognize this poster? How many of you don't recognize it that are in dialysis facilities? Okay, that's not good. This is a poster that tells you if you have a concern about your facility that you can contact us. We process grievances. And this is a requirement of all facilities to have this poster in their center. It should be in an obvious place. You should be tripping over it, literally. So I would encourage you to go back to your center and ask about that poster. And they can get one from us. They're free. We'll send them out. We send replacements all the time. At any time, they can have more than one. So look for that. Some of the things that we do at the MidAtlantic Renal Coalition, we have duties because we are contracted by the Centers for Medicare and Medicaid Services, that's CMS. We're contracted by them to provide quality improvement activities with dialysis facilities. We do that by offering some technical support. There's a lot of data that comes in, and we look at different measures and different indicators to see how well a facility is providing care and the quality of care that they're providing. And so our main focus is to help them improve that, to make that the best that it can be. Some of the technical support that we offer for that is education, resources, training. I mentioned the grievance poster. We do provide a big part of what we do is to process patient grievances. We do that in collaboration with the state healthcare organizations. They're the folks who are responsible for quality assurance, making sure that facilities are doing the things that are required of them, whereas we work to help them improve that. We work with the state, we work with quality improvement organizations that are also healthcare organizations, and we work with primarily the state, but there are other organizations that we can work with, the dialysis facilities, for example, to try to address issues that are going on that are making patients unhappy or dissatisfied, and to try to find resolution to that. We're not always the people that are the best to go to for that sort of thing, but we certainly, if it's not part of our jurisdiction or part of our expertise, we will assist with making sure that you get referred to the place that would be most appropriate. We offer educational resources, not only to the patient population, but also to the providers. We have webinars that we hold. We've got different educational opportunities, both face-to-face as well as by conference call or by webinar. There are educational resources that we develop in print. We're currently working on developing some DVD type things so that folks can access that at any time. We have an inordinate amount of reporting that we have to do. We are responsible to the Centers for Medicare and Medicaid Services for the work that we do, so there's quite a bit of reporting we do back to them. And there is a lot of data in dialysis. We used to be the primary people to collect that data. We've been removed from that process now. They have, I think in the last 5 years maybe, introduced a system called Crown Web, and that is the primary deposit for all renal-related data. It's things like, it's patient-specific, so there's your information in there. That's triggered by when you start dialysis, there's a form called the 2728 medical evidence report, and that's indicating to Medicare that you have begun a course of chronic dialysis in the outpatient setting, and it provides information about the cause of your kidney disease, information about the types of other issues that you have going on with that, like diabetes or high blood pressure. And then as you are in dialysis, there's a lot of information that goes in there about the quality of care that you're getting, so the adequacy of your treatment, whether or not you've gotten an infection, information about your lab results. So there are 18 networks throughout the United States. We are one of them. We are the 5th one, and that covers Maryland, DC, West Virginia, and Virginia. They all do the same thing that we do. It's just a different territory that they're responsible for. We are not the largest organization, but we're pretty large. And this gives you a little, maybe another picture of what that size looks like. We have in our entire network area right now 349 dialysis facilities. We also have 12 transplant centers, and these all serve approximately 25,500 patients. So right now, our contract, we are assigned a 3-year contract. This contract that we're on right now runs through the end of 2015. At that time, we will be competed, so we'll have to put a bid in to get this territory again. Hopefully, we'll get it. But that's to keep the competition going and to make sure, and that's good. And that's to make sure that the best people are in that position to provide that oversight. So this is the new contract that we got. This is a revision. I don't think they've ever revised the contract until last year, 2013. But basically, it is based on the Institute of Medicine's 6 healthcare aims, and those are national healthcare aims. And those address things like safety, effectiveness, patient-centeredness, timeliness, efficiency, and equitability in care. Let me just get through this. These are great questions, but I am concerned about getting through. But there should be plenty of time, okay? So the aims were developed, these 3 aims were developed specifically for the ESRD group. So all healthcare in ESRD, end-stage renal disease. There are 3 aims: better care for the individual through beneficiary and family-centered care, and that's the primary work that we do. We do all this, but that's the primary thing that we do. Aim 2 is better health care for the ESRD population, so it's looking at it more broadly rather than down at the individual patient level. And then the 3rd aim is reducing cost of care by improving care, which is the ultimate goal overall anyway. So the bulk of our work is through that aim 1. And these are 3 projects that we are required to do annually based on that aim, that first aim. And so there are 2 patient engagement educational campaigns. You may have seen these in your facilities. Not every facility was required to do this. But the aims that the projects that were chosen this year for the campaigns included the Ask Me to Wash My Hands campaign, and the It Starts With Me campaign, and that's a peer mentor support and education campaign. There were posters and pledges, information sent out to the facilities. Each of these campaigns affected only 20% of the dialysis providers, dialysis facilities. So you may or may not have seen these in your facility. That roughly is 66 facilities that would have made up. They were randomly selected, so if your facility was in a project, it wasn't because of anything that they did or didn't do. They were just randomly selected. The quality improvement activity that we did was on mistreatments this year, and that had to impact 10% of the patient population, which was about 33 facilities. Did any of you all recognize any of these materials, or were you aware of your facility being involved in any of these projects? A couple of you, okay. So let me ask you all what engagement means to you. This is a phrase that is tossed around in the patient engagement movement that's going on. The phrase is nothing about me without me. We are all unique people. We all have different values. We have different things that we think are important to our healthcare and to be maintaining a good quality of life to us. What is important to me may not be important to you, and vice versa. So the notion of nothing about me without me is about, changing the way the healthcare system traditionally has been in America, which has been pretty paternalistic. It's the doctor telling you what you should do and what you shouldn't do, and you just going, okay, I'll do that, and trying to do that. Rather than having a dialogue about, this is what's going on with you, here are the options. What do you want out of treatment? What do you want out of your healthcare? What's important to you? What can we do to get the best care possible for you in a way that's meaningful to you? Having a discussion and an agreed upon attack for how you want to proceed with the kind of treatment or whether or not you want that treatment at all. So some of the things that were mentioned that people often say when they talk about feeling engaged is that they felt involved in the decision, that it wasn't just thrust upon them, that they were part of that coming to that decision, that they felt listened to, that they had questions that were answered, that they were engaged in a discussion about things, that what was important to them was heard, feeling better informed to the choices that suited the person. So again, not just being told what you're going to do, but being told that there are different choices out there and what's important to you. You've got these options are available to you and may help you to select something that best fits your what's important to you, your desires. And then feeling genuinely cared about, not just another person or another commodity or another thing that's being pushed around, or it's not a cookie cutter kind of thing. You're an individual person, you have individual things going on with you, and so there are individual unique things that should happen to provide you with the care. So patient-centeredness really looks at respecting what the patient's cultural background is, what their values are, what preferences they come in with, taking into consideration also family situations and demands and lifestyle choices. It would consider patients to be an integral part of the decision-making process, that they are going to be involved in making decisions about the way the treatment's going to go and the way that the care is going to be provided. Recognizing that patients are responsible for self-care and self-monitoring. As a dialysis patient, you're probably getting treatment 3 times a week for maybe 3 or 4 hours. The rest of the time you're at home or wherever, you're not in dialysis and you're taking care of yourself. So except for maybe 12 to 15 hours a week, you're self-managing. You are the one making decisions about whether or not to have that extra, beverage, whether or not you're going to take your medicine at the prescribed time, whether or not you're going to go to treatment, whether you're going to cut your treatment short. These are all decisions that people make, and you have that autonomy. You can make those decisions. So you do have a right to make decisions for yourself. You have a right to make good decisions and a right to make bad decisions too. But patient-centered care recognizes that you've got choices and that you have to make decisions that suit you, that fit for you. Patient-centered care also considers patients to be deserving of respectful, coordinated, and efficient transitions. And that can be things like moving from the primary care physician's office into the dialysis setting, into a nephrologist's office, or moving from dialysis into transplant, or moving from transplant back to dialysis, or even considering not doing treatment at all. These are all transitions that people need to be respected for and helped through the process. So the Centers for Medicare and Medicaid Services has federal regulations that the dialysis providers have to adhere to. There are specific things within those regulations that address patient-centeredness, one being that the patient has a right to be informed and participate, if they desire, in all aspects of the care that's being provided. And also the assessment that is done would be comprehensive and include the patient's abilities, their interests, preferences, and goals, including the desired level of participation that they want to have, and the modality type that is chosen, the modality setting that could be done in, and the patient's expectation for the outcomes of the care. So I didn't title this very well, but basically these are examples of what I think that a clinic looks like when they are providing patient-engaged care. That they would have the expectation that the patient would participate in the planning of their care. So, and I'm not just talking about them going around because they have to invite you to the care plans. We're having a care plan, it's on X date at X time, gonna come or not. That's not patient engagement to me. To me, patient engagement is we're having a plan of care. It's really important that you be there. This is what a plan of care is. This is what we need to talk about. Would you like to be involved in that? These are the times that we have it scheduled. Does that suit you? If it doesn't, what can we do to get you in there? Can we visit at your chair side? Is that okay? Or do you want to phone it in? Do you want to call us and we can conference you in to the meeting? Can we check and maybe do a different time that we could all meet? So the engagement piece is that they're trying to recognize that you've got a life outside of dialysis and that these are going to be making demands on your time and your availability, but it's important that you participate, and that's the point they're trying to get across. It's that important, we're going to do what we can to accommodate your needs so that we can get that done. Involvement of patients in policy and procedure changes. I don't think there are too many facilities that do this. I think this is a scary thing for facilities to do. But the facility that truly recognizes patient engagement isn't going to be threatened by it. And they're going to see the value of involving patients in these types of processes, because ultimately the policies and procedures that they develop affect you. So for example, the visitation policies, that's an easy one to pull out. How many of you, or your schedule even, you know, the schedule's always getting changed. Are you consulted ever? No, you're told this is the schedule change and this is why, right? So, you know, if we had patients involved in developing these policies and procedures and changes that are going on in the facility, you have a better representation of what's going on with the patients and potentially a better way of getting what needs to be done in the facility done without upsetting everybody. Availability of peer mentors, that's important. Because one of the things that peer mentors do is help to make other patients feel comfortable and know where to find information, who to go to with questions, and somebody just to talk to about, you know, someone who's been there and done that, you know, and has coped and adjusted in some way. How did they do that? How can I learn from that? It's very important to have somebody, and sometimes I think it's a lot easier for people to understand what's going on with the treatment when somebody who has been there and has gone through it can communicate that to you, what their experience was with it. And then promotion of increased independence. The whole idea of doing dialysis to me is that, you know, you're choosing to continue with the goals that you set ahead of for your life, you know, the things that you wanted to do. So dialysis should be a way of helping you to continue to meet those goals. Maybe they need to be modified some way because of current limitations, but it's continuing to explore that and continuing to be independent as much as possible is very important. And I think that that's something that a facility that recognizes patient engagement is going to be working with you on, is understanding what's important to you, what do you want out of your life, and what can we do with the treatment to help you meet those goals. So my organization engages patients in several different ways. These are three primary ways that we do it. Patient liaisons are selected by the dialysis facility. Typically, they are patients that the facility sees as good mentors, good role models for other patients. The patient liaison acts as a bridge between the network and other patients in the facility. It's a way for us to communicate to other patients more directly. What we have found historically is that when we send information to facilities, you know, it'll end up on a bulletin board or it'll end up on a table, and all that I know becomes wallpaper. You know, people just don't see it after a while. So unless it's actually handed to somebody or have a discussion about it, it typically is not recognized. So one of the things that we've tried to do with the patient liaisons in each facility is have a person that can help to provide that information to other patients. They also are instrumental for us in acting as focus groups. So when we have educational materials or questions about what's important to patients, that's a group that we can go to for that information and to help us develop things. Subject matter experts are new to us. This is something that we have started with this new contract. These are patients. It is open to any patient that is interested in doing it. These subject matter experts are the voice of patients. They are part of the development of all of our projects that we have going on, particularly with the patient engagement projects that we have. They're the ones who determine what the focus of those projects are going to be, what those topics are going to focus on. So they drive that. They also help us to develop materials for the projects that we work on. The Patient Advisory Committee is made up of 10 to 12 people, And they are responsible for advising our medical review board and our board of directors. They also help us develop, it was their brainchild, really, our patient education series that we have monthly. That was something that they developed for us and for you. The other things that we have done and have always done with including patients is by having patients participate with us on panels when we're doing conferences. They often are recruited to help act as, we call them arm models. So they provide us with their access arm when we're doing assessment clinics. And we've got a assessment or a needs assessment that we've sent out recently that you may have seen. I hope you have seen. And we were asking patients to provide us with some information about the kind of education that's important to them, things that they want to know about, and in what way they would like to participate or to have that information presented. So there are top 10 ways to be engaged that, and this is, I'm biased, this is my presentation, so this is what I decided was the top 10 things. This isn't any big study that was done, I assure you. So number 10 on my list of top 10 engagement things is to sit in on your plans of care. How many of you know what a plan of care is? Okay. How many of you have sat down in on it? Oh, very good. Good. So the plans of care that's where you've got your main team of clinical people. So that is the social worker. I'm a social worker by training, so of course that's the number one person to me. The dietitian, the nurse, the physician, maybe the medical director, maybe a care technician, and then the patient. Patient is really probably the main player in all of this. Very few people historically have participated in the plans of care. So it's really important that you do, because they're talking about where you're at currently with your treatment, where you should be for the best care ever, your best outcomes, and then what the plan is to get you from where you're at now to where you really potentially could be. And you're important in that, because you're the one that's going to decide whether or not the plan is going to work for you. So if, for example, you've got inadequate dialysis, and the dialysis team says, okay, so we're going to increase your dialysis time to address that. If you don't sit in on that care plan, you're going to come in the next day and someone's going to tell you we're bumping up your time on the treatment, and you're probably not going to be happy with that. But if you were sitting in on that plan and they mentioned that, then you could say, oh, well, that really isn't going to work for me. What are the other options that we have? Hopefully they will have already said, there are many ways that we can address this. Here they are. What one do you think you would like to try? That would be the ideal way. But certainly sitting in on that care plan will allow you to hear what's going on, what decisions are being discussed or decided or put on the table, and then you can ask questions and prompt them, what other options are there? Is this all there is? So number 9 is to continue to educate yourself. I applaud you all very much for coming out here today. This is an excellent way of getting information. There's all kinds of resources out there on the internet. There's all kinds of agencies out there that provide information. There's written information. Your facility's got information. The National Kidney Foundation's got information. There's a wealth of it. The more you can educate yourself about your treatment and your illness and your options, the better off you're going to be. Number 8 is to complete the InCenter Hemodialysis CAP survey. That is a consumer assessment of healthcare providers and systems. That's a mouthful, but basically it's not a survey of your satisfaction. It's a survey of the experiences of care that you've gotten. So what they're trying to do with this survey is to assess the kind of care that you got and how you got it, how frequently you got it, and whether or not it met your needs. This is something that is required now by the dialysis facilities. They are required to have a third party administer it, so there is no concern that you're going to be providing any information that the facility is ever going to get, because they're not. It's an anonymous survey, and a third party is administering it. And the information that gets back to the dialysis facility is aggregate, meaning that it's lumped in with all the other people that responded to that survey. So they get one number. That's everybody said, or 80% of the people said this, So what they do with this experience of care is the other thing that you want to know about from the facility is what are they doing with the results that they get back, because they get the results back. You want to see that they're looking at that information and that they're addressing the areas where they're falling short and not meeting needs, and that they've got a plan in place to try to address that. One of the better ways that that a facility that embraces the engaged patient can do is to share that information with you, make that obvious, and ask you, what do you think we could do to make this better? This is something, if you see this happening next year, they're going to start doing it twice a year. If you're asked to do this, I encourage you to do it. This is something that the dialysis facilities are going to have impacting their reimbursement at some point. I believe it's this year, actually, that is going to impact their reimbursement in the future. The other thing that I encourage you to do is to complete the kidney disease quality of life assessment. This is a tool that is a mental health tool, basically. But what it's doing is assessing how dialysis is impacting you, how your illness is impacting you, how much of a burden all of these demands are on you, if you're having problems with depression or anxiety, if you are having physical issues that are bothersome to you. It assesses all these things, and this is a tool that once you take it, it shouldn't just disappear. This should come back. The results should come back to you on your own individual level. The social worker is primarily the person that's going to be giving you this, and at least annually it's to be done. It may be done more frequently. What you see up here is a tool that a lot of dialysis facilities have subscribed to, and it provides these nice little graphs, so it gives you a nice representation, a nice picture of how you're scoring on these different levels. But this is an important thing for you. It might, when you take it, the results might surprise you or it might not, but it's a picture in time of how you're doing with treatment and how it's impacting you. Number 6 is to explore other options. So don't just, if you're doing in-center hemodialysis, I hope that it's not just because someone said, well, you need dialysis, we're going to put you in in-center hemodialysis. You, at any point, can decide that that's not working for you and you want to try something different. I encourage you, I implore you to look at the other options that are out there. Look at transplant, look at the different home options. There's nocturnal dialysis. And if nothing else, I encourage you to learn to do as much as you can for yourself for the treatment, including learning to self-cannulate, learning how to put those needles in yourself. Ask about emergency procedures and have an emergency kit. Dialysis facilities in an emergency can shut down. They can be, compromised for a long period of time. You may be snowed in, your house might be blown away by a tornado or whatever, but you should know, if the dialysis center isn't open, where am I supposed to go? Who am I supposed to contact? If I can't get out of my house to get to treatment, what am I supposed to do? Who am I supposed to contact? And emergency procedures are something that should be reviewed with you at least on a quarterly basis. I can tell you, working in a dialysis center, I was not comfortable with the emergency procedures. I couldn't remember after a quarter what I was supposed to do. So, periodically ask yourself, all right, if there was an emergency, what do I do? And if you can't answer that question, ask somebody to tell you, what are you supposed to do? And get a kit at home, just in case you're stuck there. And there's all kinds of resources out there about that. Act as a peer mentor. Reach out to new patients. Share your experiences with them. Hopefully they're positive experiences, but try to share positive ways of adjusting to the demands of treatment and the demands of illness. Find Find out as much as you can about where information is kept in the facility, who should be referred to when there are questions about medical stuff, or if there's questions about the care that's being provided. Educate yourself about those kinds of things so that you can best direct other people to where they can get those answers and resources. Number 3 is find out what your clinic's quality, I always get this wrong, it's not improvement, it's quality incentive program. This is a fairly new thing to dialysis facilities, but you should recognize this form. If you don't, this is something you should go back to your dialysis facility, look for it, ask your manager where that is kept, because it's a requirement that they have that posted in a place that you can see it. That score is a representation of different measures, different quality measures that your dialysis facility has provided in the last year or so, and that number determines whether or not they're impacted for their reimbursement. So all these measures, they're measuring anemia, they're measuring adequacy, they're measuring infection rates, they're measuring whether or not the dialysis facility provided the ICAP survey, and I believe this year they're requiring a score out of that to be of a certain level to meet the measure for that on here. Anyway, so what you need to know about this is that it's directly tied in with measures that the federal government has deemed to be important to as an indicator of good care in the facility. It's their report card, so to speak. So you want to know what your facility's rate is and whether or not that was a good enough rate. And what is the facility going to do with that? Ask about clinic projects that are going on. Every dialysis facility's got stuff going on. The network has a lot of, like 80% of facilities are in a network project. But dialysis facilities are always looking at their mistreatment numbers, they're always looking at their adequacy rates, they're always looking at their infection rates, all kinds of stuff going on that they're going to be working to improve. Whether or not they've notified you of that, whether or not they've asked you about what you think would help to improve those rates, that's another story. But you certainly can go up to your manager or even the social worker or the medical director and ask them, you know, what kind of projects you got going on in here? How did you get involved in that? What made you select that? So real quickly, because we're running out of time, my number one, because like I said, this is my list, my number one is for you to become a subject matter expert, to be a spokesperson for other patients, and to have a say in the projects that we're doing, and getting that information back to other facilities and patients. Included in your handouts should be a brochure about that, as well as an application for it. I encourage you to complete that and join us. Also, this picture up here, whoops, I don't know what that happened, sorry. The picture up there is of a flyer that I hope you've seen, but that is information about the educational, patient educational series that we have every month. And the topic changes every month, and we send information to the facilities every month about the new stuff. So hopefully you've seen it. Also, a grievance brochure, I believe, is in your handouts. If you are so inclined and network savvy, you can follow us on Twitter, or you can follow us or like us on Facebook. We have a presence there. We are always posting things directed at patients. It's kidney patients of the Mid-Atlantic region. So I do have cards. Thank you all very much for participating, and enjoy the rest of the conference. And if you've got more questions, I'm happy to answer them. You can come on up and I'll talk to you.